Good morning. I hope you guys are doing well. In this video, we cover important dental terminologies. Our first term is cusp. Cusp is a peak or an elevation on the occlusal surface of the tooth. Generally, posterior teeth will have cusps. The number of cusps differs in different sets of teeth. For example, lower permanent first molar has almost 5 cusps. This diagram shows different types of cusps, different number of cusps. I show the diagram of cusp. Here you see these are cusps. Now the next term is ridges. Ridges, a narrow elongated elevation on the surface of a tooth, is known as ridges. The ridges are named depending on their location: buccal ridge, marginal ridge, incisor ridge, and oblique ridge. This diagram shows different types of ridges. The elevated part is ridge. It is present if it is present on the margin surface, it is known as marginal ridge. If present in transversely, then transverse ridge. It is present obliquely, then it is oblique ridge. Now, our next term is grooves. Grooves are developmental folds. Clefts of the fissure usually found on the occlusal, buccal, lingual surface of posterior teeth. They separate the primary part of the crown, namely the cusp or the root. They may be either shallow, wide, deep, and narrow. They play an important role in initiation of the tooth decay or dental caries. For example, buccal grooves of molars. This diagram shows grooves. The deep portion is groove. Now, our next term is sulcus. Sulcus is a long depression found on the occlusal surface of the posterior teeth between ridge and a cusp. The incline of which meets at an angle. A sulcus and a groove are two different entities. And in fact, every sulcus has a developmental groove at the junction of its incline. This diagram shows sulcus. Crown and ginger. This portion is sulcus. Now, fossa. Fossa is a depression or a concavity found on the surface of a tooth. Depending on their location, they are named as lingual fossa, central fossa, and triangular fossa. Lingual surface, on the lingual surface of the incisor, lingual fossa. Central fossa found on the occlusal surface of molar. Triangular fossa on the occlusal surface, either median, distal, marginal ridges are found on the molar and premolar of the triangular fossa. Now, this is fossa. Here you see fossa. Now, next term is pit. Pit are small pinpoint deep depressions in the enamel, sometimes in dentine of a tooth also. They are usually located on the junction of developmental grooves or at the terminal of these grooves. In molar, where the developmental grooves in the central fossa meets, there results a central pit. In about 50% of the permanent molar at the termination of the buccal grooves, there lies a pit. Next, they can act as an area for initiation of dental caries. This diagram shows pits. In crown surface where the developmental grooves meets, the pinpoint structure is called pits. These are responsible for dental caries because in this food lodging, then initiation of dental caries. Now, mamelons. The small protuberance usually present on the incisor edge of the newly erupted incisors are known as mamelons. Each mamelon represents a lobe or a primary section of the formation of development of the crown, which it's belong to. These diagrams represent, here you see small protuberance on the teeth. These are called mamelons. They are worn out with uses. They are worn out uses, or they may be missing by birth, as in case of the congenital crown. Now, our next term is embrasures or spillway space. These are generally asked in short note in your university exams. Embrasures or spillway space is a triangular interproximal space formed around the contact point due to divergence of the tooth surface from the contact point. Here you see these are spillway space. This is present between two teeth. Here you see these are spillway space. Here you see. Now our next point is contact point. These are small circular or oval areas on the proximal surface where two adjacent teeth contact or meet each other. This diagram shows contact area where two teeth are meet at a particular surface. This is called contact area. There is no difference between the contact point and contact area. When the contact of two teeth involve a smaller area, it is termed as contact point. With uses of these teeth in a function, the so-called contact point wear away and a wide area of a proximal surface results. This type of contact is termed as contact area. Now, if a tooth is when two teeth are contact with a particular area is called contact point. If a area, then it is contact area. Thank you. That's all for today's lecture.